Psychiatry for 6th semester students of the Faculty of Medicine. Psychiatry is a branch of medicine that studies mental disorders, including their diagnosis, treatment, and prevention. Psychiatry aims to address various psychological issues that affect behavior, emotions, and thought patterns. In Semester 6, the psychiatry course teaches an in-depth understanding of various mental disorders and their management based on evidence-based approaches. 1. Introduction to Psychiatry. Definition of psychiatry. Psychiatry is a branch of medicine that focuses on the study, diagnosis, and treatment of mental and emotional disorders. Objective of psychiatry: to improve mental health, reduce symptoms of mental disorders, and help individuals function well in their daily lives. 2. Basic concepts in psychiatry. Mental disorders. Abnormalities in mental or emotional function that affect behavior and the ability to function in social and work life. Etiology of mental disorders. Biological factors. Chemical imbalances in the brain, hormonal disorders, or genetic abnormalities. Psychosocial factors. Stress, childhood trauma, or poor interpersonal relationships. Environmental factors. Cultural influences, socioeconomic status, and life experiences. Psychiatric diagnosis. Using clinical interviews, behavior observations, and psychological assessment tools, e.g. questionnaires or rating scales. 3. Common psychiatric disorders. Mood disorders. Major depression. A condition where individuals experience hopelessness, loss of interest, and extreme fatigue that disrupt daily functions. Bipolar disorder. A mood disorder causing extreme shifts between euphoria, mania, and depression. Anxiety disorders. Generalized anxiety disorder, GAD, excessive and uncontrollable anxiety about various aspects of life. Panic disorder. Sudden and severe anxiety attacks, often accompanied by physical symptoms like palpitations, shortness of breath, and dizziness. Phobia. An irrational fear of specific objects or situations, e.g., fear of crowded places or animals. Psychotic disorders. Schizophrenia. A severe disorder affecting thought, emotion, and behavior, often involving hallucinations or delusions. Delusional disorder. The presence of false beliefs or delusions without a clear basis. Eating disorders. Anorexia nervosa. A desire to avoid food through extreme weight control. Bulimia nervosa. Binge eating followed by compensatory behaviors like vomiting or laxative use. Binge eating disorder. BED, excessive food consumption in a short period without compensatory behaviors. Personality disorders. Antisocial personality disorder. Disregard for others' rights, manipulative behavior, and often involvement in criminal activities. borderline personality disorder, instability in interpersonal relationships, self-image and emotions, narcissistic personality disorder, excessive reliance on praise and a sense of superiority, post-traumatic stress disorder, PTSD, occurs after experiencing a traumatic event, causing flashbacks, nightmares, and excessive anxiety. 4. Psychiatric examination, clinical interview. An in-depth interview with the patient to gather information about symptoms, medical history, and underlying causes of the disorder. Mental status examination, MSE. A comprehensive observation of the patient's mental condition, including attention, perception, mood, and behavior. Assessment scales, using standardized tools to assess the severity of the disorder, such as the Hamilton Scale for anxiety or depression. 5. Treatment in psychiatry, psychotherapy, cognitive behavioral therapy, CBT. Focuses on changing negative thought patterns and unproductive behaviors. Psychoanalytic therapy helps patients become aware of subconscious conflicts affecting their behavior. Group therapy uses group interaction to discuss problems and gain support. Pharmacological therapy, antidepressants, to treat mood disorders, such as fluoxetine, Prozac, or sertraline. Anxiolytics, medications to reduce anxiety, such as diazepam or alprazolam. Antipsychotics, used to treat psychotic disorders like schizophrenia, such as risperidone or olanzapine. Mood stabilizers, for bipolar disorder, such as lithium. Electroconvulsive therapy, ECT, an electrical treatment used for patients with severe depression that does not respond to other medications. 6. Approach to psychiatric patients, holistic approach, understanding the patient as a whole, considering physical, psychological, and social aspects. Effective communication, using empathetic communication techniques to build trust with the patient. Family involvement, involving family members in the treatment process to support the patient's recovery. 7. Child and adolescent psychiatry, developmental disorders, autism spectrum disorder, ASD, a developmental disorder that affects social interaction and communication. Attention deficit hyperactivity disorder, ADHD, characterized by an inability to focus, hyperactivity, and impulsiveness. Mental disorders in adolescence, depression, anxiety, and behavioral disorders often emerge during adolescence and affect social and academic development. 8. Geriatric psychiatry, mental disorders in the elderly, dementia, severe cognitive decline, such as Alzheimer's disease, mood disorders, depression and anxiety commonly occur in the elderly. Psychiatric conditions in older adults. Understanding psychological changes that occur with aging and their management. 9. Prevention in psychiatry. Early detection of mental disorders. Recognizing early signs of mental disorders to prevent further development. Community-based approaches. Raising awareness about mental health and reducing the stigma surrounding mental illness. Psychoeducational support. Providing information to patients and families about mental disorders and how to manage them. 10. Challenges in psychiatry. Social stigma. Addressing the stigma often faced by patients with mental disorders. Resource limitations. Challenges in providing adequate mental health services in many regions. Conclusion. Psychiatry is a vital branch of medicine that provides insights into mental disorders, encompassing prevention, diagnosis, therapy, and rehabilitation. In Semester 6, students will learn about common mental disorders, how to detect them, and effective treatments, both through psychological and medical therapies. Psychiatry also covers important aspects such as family involvement and a holistic approach to patient care.